So a real nice application for periodontists and surgeons of using the 3600 full color scanner is the ability to send the full color files back to the referring base for one, marketing purposes, two, for the referring dentist to see what the tissue looks like prior to going to final restoration. So that could be an objection for this workflow for that periodontist or surgeon. So being able to send full color files and clinical photos very, very easily back to that referring dentist is a huge application. So this is all pre-refinement, and we've got our soft tissue scan. The next step would be to put the scan body in and scan that. But prior to doing that, you can use the intraoral camera feature, and I can grab a bunch of images by hitting the checkbox, and it gives me, every time I hit the checkbox, it shows what the soft tissue looks like in that area. So now I've got 4 images, or as many as you want, to send back to that referring dentist with the actual full color DICOM model. So now we're going to refine the data. And we'll save the data. So now we're back in the imaging software. So now what I can do is, prior to sending everything to the lab, I can actually send the entire case to that referring dentist. Here's the scan that we just saved, and you can see we've got the actual scan, and we've got those 4 clinical photos that we captured. When I use CS Connect, which is a free digital portal, to send this case to the lab or to the referring dentist, all of these images will go, photos and the actual full color scan. So that referring dentist can also download and install for free CS Connect. They can also download for free from CareStream CS Mesh Viewer. So it's a free viewing software for viewing full color files, the full color digital models. Download that stuff again for free and be able to manipulate the scan just like you did and look at all the clinical photos. So it's a really, really nice application to communicate better with your referring base prior to going to final restoration. And here's what the referring dentist is going to see once they receive the email and download the file. They're going to get the STL files with and without the scan bodies. The STL files are used by the lab for planning. They're going to get the full color DICOM file, which all they have to do is right click, open with CS Mesh Viewer. So now the referring dentist can take a look at the scan just like you were looking at the scan. And then on top of that, they're going to have those 4 JPEGs that we captured. Really nice for that referring dentist to make a decision about going to final restoration, saving themselves a visit, saving the patients a visit.